Less than P class equals data end equals 52. O data start equals 93 greater than. It's both inspiring and sobering to think about how one moment in a child's life can ripple across history. That's exactly what happened in 1954, when an 11-year-old boy named David Edmonston came down with measles at a boarding school in Massachusetts. He couldn't have imagined then that his blood, collected as part of a research effort, would become the foundation for a life-saving medical breakthrough, the measles vaccine. Less than P class equals data end equals 972. Data start equals 522 greater than. Fast forward to today, and here we are, facing a measles outbreak that's infected over 500 people across 22 U.S. states, tragically claiming the lives of 2 children in Texas. For over a decade, the United States had seen no measles-related deaths. Now the conversation has returned with urgency, and David Edmonston, now 82, has stepped forward to speak again, this time with deep concern about misinformation, public hesitancy, and what's at stake. Less than P class equals data end equals 1412. Data start equals 974 greater than back in the 50s. After recovering from measles, David was asked by Dr. Thomas Peebles of Boston Children's Hospital to provide blood and throat washings. Researchers isolated the virus from his samples, which later became known as the Edmonston B strain. This was the beginning of what would evolve into the MMR vaccine, one of the greatest triumphs of 20th century medicine. It's estimated to have saved nearly 94 million lives globally. Less than P class equals data end equals 1841. Data start equals 1414 greater than. What's striking is that even someone so connected to the vaccine's history wasn't immune to doubts. Years later, when he became a parent, David and his wife chose not to vaccinate their son based on misinformation. Looking back, he regrets the decision. He's now a vocal advocate for immunization, using his unique story to stress how vital these vaccines are, not just for individuals, but for the collective health of society. Less than P class equals data end equals 227. O data start equals 1843 greater than. And in a twist that's igniting debate, Health and Human Services Secretary Robert F. Kennedy Jr., long seen as a vaccine skeptic, has publicly endorsed the MMR vaccine as the best defense against measles. This shift is backed by science. 2 doses of MMR provide 97% protection, yet this stance has angered many of his past supporters, especially from anti-vaccine circles. It's a controversial pivot, but perhaps a necessary one. Less than APE class equals data end equals 2643. Data start equals 2272 greater than. Meanwhile, the Texas Department of State Health Services has expanded its outbreak designation to 10 counties, urging residents of all ages to check their vaccination status. The state has also addressed confusion around vitamin A treatments, clarifying that, while it may support recovery in some cases under medical supervision, it is less than M data end equals 2613 data start equals 2608, greater than not a substitute for vaccination. Less than P class equals data end equals 3073, data start equals 2645, greater than. David Edmonston, with quiet conviction, says he's speaking out now to humanize the story of vaccines. He remembers the ethics and care of the researchers he worked with all those decades ago, and he believes that same integrity continues in modern vaccine development. In a world clouded with skepticism, his lived experience is a powerful reminder. Vaccines aren't just science. They're stories, lives, and legacies intertwined. Less than P class equals data end equals 3225. Data start equals 3075 greater than. So if we want to protect the next generation from preventable tragedies, it starts with listening to those who helped prevent them in the first place. Stay subscribed for more videos.